agus taso imagination with leaders' questions, understanding order 36. And again, just before we start, to everybody, if you could comply with the Shrianta Amma Vein Buitiv Galer. So I shop the Marylou McDonald.
Can I begin just by sending, I'm sure, all of our best wishes to our colleague, the Ceann Comhairle, Sean O'Farrell, and send him all our very best for a full and speedy recovery. Taoiseach, the failure of government to plan for the COVID surge has created enormous pressure. GP services are overwhelmed and schools are struggling. In large swathes of the country, people can't get a PCR test while government still dithers on antigen testing. But it is in our hospitals, particularly in ICUs, that we see the sharpest impact. The capacity crisis in ICUs didn't happen overnight. A HSE commissioned expert report published in September 2009 recommended that intensive care unit beds be increased from 289 to 579 beds. So successive governments have known about this problem for more than a decade and have done nothing. In fact, they cut a further 40 beds out of the system between the publication of that report in 2009 and the onset of COVID. This lack of foresight has continued throughout this pandemic. The vaccination programme and lockdowns bought precious time to prepare hospital capacity for surges, but government has wasted these opportunities. Even in the recent budget, you tinkered around the edges on ICU capacity. We don't have either the number of personnel to staff our ICUs safely, even in normal times. Experts tell us that we need 150 to 200 additional ICU beds and increased specialist staff for hospitals to cope. Taoiseach, we can't underestimate that the failure to properly resource our hospitals has devastating consequences and very serious knock-on effects for our society. Indeed, protecting our health service from collapse is a key reason for the prolonged use of restrictions. And lack of capacity also has dangerous consequences for those requiring vital care and life-saving procedures. Earlier this month, a transplant operation was cancelled in Dublin's Mater Hospital because there was no ICU bed available. Now, I cannot imagine how distressing this was for the patient, for their family, for the doctors, indeed, who had to make this call. There should have been an ICU bed for this patient. There would have been an ICU bed had government planned properly. We're already playing catch up on missed non-COVID care. We're facing a tsunami of missed care in the coming months. And not having the additional ICU bed capacity is putting patients at real risk. And your government continues to turn up a day late and a dollar short. We're now 2 years into this pandemic. We're at 12 years into the ICU capacity crisis, and government doesn't come even close to doing enough on ICU capacity. And as we watch our hospitals filling up again and as restrictions are reimposed, the big question that people are asking is, what is government waiting for? Taoiseach Don, Gantanas Lapacus and ICU ar cur brew ar na hispedale agus a cur na hihar in Wales. Cahi túro deig na of goprana kun an achfin in our ICU and a vedu gudi an level richtadog. So Taoiseach, what is the government's plan for ICUs to meet this surge today? What's the status of our surge capacity and when will it be deployed? And have you instructed your Minister for Health to begin properly and permanently resourcing our ICUs to the required levels so we don't end up here again?
Caithfidh mé rá go bhfuil méadú tar éis tagatha ó thaobh na méid lepacha atá going agus na lepacha ICU go háirithe a bhfad níos mó anois a going ná mar a bhí a going de sach na bliana se chatte agus níos mó lepacha I generaltas na hospedéal chomá, níos mó tastálanna ar siúl, ní hamháin antigen nach PCR sústa 2,000 fan géad. So first of all, Deputy, I will say that there are four broad areas where we have to deal with this current fourth wave. And just to say overall, Ireland's performance so far in terms of the pandemic on the key metrics of mortality and in terms of protecting life in severe illness stands up to most countries across Europe and the globe. And we are have been in a better position consistently for quite some time, and that should be acknowledged because of measures that we have taken. The booster campaign is well underway now, to inform the House. Over 600,000 boosters have been administered, and this is on top of a record and very effective overall vaccination rollout programme, where we have close to 93% of the adult population fully vaccinated. And in terms of hospital beds, we've provided close to 1,000 in 2021, extra beds overall in terms of hospital beds, and we'll provide more in 2021. So the last year and a half to 2 years has shown a dramatic increase in the number of hospital beds. And in terms of intensive care beds, we've gone from 255 intensive care beds to 300 intensive care beds within the system, and we will have to go more in 2022 at a minimum to get to 340 intensive care beds. I'd like to go more beyond that. We have recruited over close to 11,000 people through 2020 and 2021, and the key issue is not resources now, because the government has provided the resources for intensive care beds and for hospital beds and for additional staff. It's the speed at which we can recruit and provide the entire capacity that an ICU bed requires. We have surge capacity to 350 if necessary, and the hospitals are under pressure because of a very transmissible variant, the Delta variant, and that is now manifesting itself in a fourth wave. And to say to you that parallel with that, of course, has been the reopening of society. We haven't had prolonged restrictions. We've reopened the economy and we've reopened society, and that is why let's be honest, that increased socialisation that automatically follows that degree of increased socialisation because of reopening of almost all sectors of the economy and society leads to an increase in infections. And this is a balance that we have to strike. Thousands of people have come back to work, and that is good for those people in terms of their individual lives and so forth. But the overarching objective of our policy in relation to COVID is to protect lives and to protect severe illness. So the motivating factor in terms of our responses now is to stop people getting COVID, to stop people getting sick from COVID and severely ill from COVID. And there's a number of ways we can do that, and it's a combination of all of those ways that we do it. I believe that operation should have gone ahead. There's enormous pressure on the matter. I would have set up that unit when I was Minister of Health in terms of, we broke new ground in terms of cerebral heart and lung transplant. There was a big debate at the time as to whether we could pull that off in terms of the numbers of cases coming through the country. But I took a decision at the time to do it, to fund it, so it's a cause of great regret to me that a transplant didn't go ahead. There is an internal inquiry going on, or investigation going on within the matter as to that. But suffice to say this, that we will do everything we possibly can to protect lives and to protect people from getting very sick from COVID.
Marylou McDonald.
Well, Taoiseach, despite your attempts to reassure or to advance the pretense that we have enough capacity in our hospitals, I mean, the evidence is that we had staff protesting outside Connolly Hospital. We hear from Limerick, for example, that other beds are being repurposed for use as ICU beds. It's very clear that the capacity falls well short of what's needed, and that fact was established as far back as 2009. And the fact also is that there wasn't an ICU bed for that transplant operation to occur. Very traumatic for all concerned, particularly the patient and their family. Can I ask you again, though, just to make clear for the Dáil, what's the plan now for ICU capacity as infection numbers are growing and hospitalisations increase? You've confirmed that we have a surge capacity, I think you said, to 350. When will that be deployed? And my final question to you, Taoiseach, was when will you and when will the Minister for Health make the permanent investment that we need in ICU to get us to a reasonable place where we're not constantly facing this danger and jeopardy.
As I said earlier, the intention now is to go to, at a minimum, to 340 by the end of 2022. We're at close to 300, 301 at the end of this year. And we do need to expand it even further. I think recruitment of staff, training of staff will be the key ingredient there. It won't be an absence of resources. And in terms of, currently we have 130 in ICU. As of today, we have 638 in hospital. These are large numbers which in themselves, in addition to non-COVID illnesses, are creating a lot of pressure on intensive care staff and on the hospital staff in general, who've had to deal now with a once-in-a-century pandemic for the guts of 2 years. And that is extremely pressurising on any employee, particularly patient-facing employees and those in the engine room of the ICU in particular. And it's very, very challenging and very, very difficult, and I acknowledge that. And that is why we've made it clear that we will provide whatever resources are required to continue to give the capacity to the HSE in terms of how it operates the hospitals and so on with the clinical staff to deal with the situation.